In 2024, a woman in North Carolina received a bill for $62,000 for an appendectomy. Think about that for a second. An appendectomy, a surgery that takes less than an hour, a surgery performed every day in hospitals across America. Her operation lasted about 45 minutes. She went home the same day, and yet the bill was $62,000. Now here's the part that makes this story difficult to ignore. Her neighbor had the exact same surgery, the same insurance company, the same year, the same city. The only meaningful difference was the hospital, just 12 miles away. Her bill was $6,400, not $62,000, $6,400. Same surgery, same insurer, same year, nearly 10 times the difference in price. Neither patient chose a hospital because it was cheaper. Neither patient was shown a price before surgery, and neither patient understood why the bills were so different. Not until they compared them at a neighborhood cookout a few weeks later. So here's the question. Why does the same surgery cost $6,000 at one hospital and $60,000 at another? Where do those numbers come from? Who decides them? Who benefits from them? And most importantly, what can you do before a scheduled procedure to avoid being blindsided by a bill you never saw coming? That's exactly what we're going to uncover today. To understand why those two appendectomies had such different prices, you first need to understand something most Americans have never heard of. It's called the chargemaster. Every hospital in the United States maintains one. Think of it as the hospital's master price list, a giant spreadsheet containing thousands of charges. Every bandage, every dose of medication, every minute in an operating room, every lab test, every procedure, from open heart surgery to a routine appendectomy. Now here's the critical piece. Hospitals largely set these prices themselves. There is no national law that says an appendectomy must cost a certain amount. There is no universal price tag. One hospital can choose one number, another hospital can choose a very different number. And that matters because insurance companies usually do not pay the chargemaster price. Instead, they negotiate a discount, maybe 40% off, maybe 60% off, maybe even more. The important thing to understand is that the discount is calculated from the chargemaster price. So imagine a hospital needs $1,000 in revenue for a particular service. If the insurer negotiates a 50% discount, the hospital might list that service at $2,000. Now suppose the insurer comes back next year and demands an even larger discount. What does the hospital do? Often it simply raises the starting price. The insurer pushes for deeper discounts. The hospital raises the chargemaster. The insurer pushes again. The hospital raises it again. And over time, the sticker price drifts further and further away from the actual cost of care. In fact, peer-reviewed research has found that hospital chargemaster prices average more than 4 times the underlying cost of delivering care. 4 times. And here's the part that surprises many people. The patient with the least negotiating power often receives the highest bill because uninsured patients can be charged at or near those full chargemaster prices, which means the price on the bill may have very little relationship to what the care actually cost. The chargemaster helps explain why hospital prices can be so high, but it doesn't fully explain something else. Why does the exact same surgery cost dramatically more at one hospital than another? The answer is surprisingly simple: market power. Imagine you live in a city where one hospital system controls most of the hospital beds, maybe most of the specialists, maybe most of the operating rooms. In some communities, a single hospital system controls such a large share of the market that insurance companies can't realistically leave them out of their network. Think about it from the insurer's perspective. If they remove that hospital from the network, thousands of patients suddenly lose access to the hospital they depend on. And a health plan that doesn't include the dominant hospital in town becomes much harder to sell. That gives the hospital leverage, a lot of leverage. When contract negotiations happen, the hospital is negotiating from a position of strength, and strength usually translates into higher reimbursement rates. Meanwhile, a smaller competing hospital across town may not have the same bargaining power. The insurer can more easily exclude them, which weakens their negotiating position. The result: two hospitals, the same procedure, the same city, the same insurance company, but very different prices. A 2025 report from the Government Accountability Office found that hospitals with dominant market positions often negotiate significantly higher payments from private insurers than hospitals in more competitive markets. And here's the important part: higher prices do not automatically mean better outcomes. The difference in your bill may have very little to do with the quality of your appendectomy, and a lot to do with how much negotiating power your hospital has over your insurance company. In other words, sometimes what you're paying for isn't better care, it's bargaining power. So far, we've been talking about hospitals, but there's another reason healthcare bills have become more expensive, and it's something most patients never hear about. It's called a facility fee. If you've never heard that term before, you're not alone. Most people don't know it exists until they see it on a bill. Here's how it works. Imagine you've been seeing the same doctor for years, same physician, same office, same parking lot, same exam room. Nothing about your visit feels different. But behind the scenes, something changed. The practice was purchased by a hospital system, and once that happens, the visit may be billed differently. Instead of being billed as an independent physician visit, it can now be billed as a hospital outpatient visit, which means an additional charge may appear. The facility fee: the physician is the same, the appointment is the same, the medical advice is the same, but the bill is higher. Research published in Health Affairs has found that when hospitals acquire physician practices, healthcare spending often increases even when the services being provided remain essentially unchanged. And here's what surprises many patients: the facility fee usually isn't discussed when the appointment is scheduled. Most people discover it later, when the explanation of benefits arrives, or when the bill shows up in the mail. So if you've looked at a medical bill recently and wondered, why am I paying more for the exact same visit? There's a good chance this is part of the answer. The doctor may not have changed, the care may not have changed, but the ownership of the practice did, and that one change can follow you all the way to the final bill. Up to this point, we've talked about why prices vary. Now let's talk about something far more useful: how to find the price before you receive the bill. Because for most of modern healthcare, patients were expected to make decisions without knowing the cost. That began to change in 2021, and the rules became significantly stronger in 2026. Today, hospitals are required to publicly post pricing information that used to be almost impossible for patients to see. Most people have no idea this information exists, but it does. Under federal transparency rules, hospitals must publish the prices they charge, and in many cases, the negotiated rates they have agreed to with insurance companies. Not estimates, not marketing brochures, actual pricing data. And that gives you something patients rarely have in healthcare, the ability to compare. So here's how you use it. Step 1. Go to your hospital's website. Search for either price transparency or standard charges. Step 2. Call your physician's office and ask for the CPT code for your procedure. Think of the CPT code as the billing language used to identify the service you're scheduled to receive. Step 3. Search that code in the hospital's pricing file. Then find your insurance company. The number next to it is often the negotiated rate between that hospital and your insurer. And here's where things get interesting. Step 4. Repeat the same search at another hospital that is also in your insurance network. You may discover that 2 hospitals performing the same procedure have very different negotiated prices. And sometimes those differences are not small. They can be thousands of dollars. So before a scheduled surgery, before an imaging study, before a non-urgent procedure, take 10 minutes and look. Because once the procedure is done, your ability to shop around disappears. But before the procedure, you still have choices, and those choices can save you far more money than most people realize. So let's put everything together. If you remember nothing else from this video, remember these 5 questions. Question number 1, is this an emergency or is it scheduled? If it's an emergency, go to the nearest appropriate facility. Do not waste time comparing prices during a medical emergency. Your priority is getting care. But if the procedure is scheduled, you have something valuable. Time, use it. Question number 2, what is the CPT code for the procedure? Call your physician's office and ask. Write it down. That number is the key that unlocks everything else. Question number 3, what are the negotiated prices at different hospitals? Download the transparency files, search the CPT code, compare the numbers. You may be surprised by what you find. Question number 4, is everyone involved in your care actually in network? Not just the surgeon, the anesthesiologist, the radiologist, the pathology group, anyone who may bill separately. And here's an important rule. Verify this directly with your insurance company. Do not rely solely on what the hospital tells you. Question number 5. Where are you in your deductible? If you've already met it, your financial responsibility may be much lower than you expect. If you haven't met it, the math may look very different. Understand how the procedure affects your deductible, your coinsurance, and your maximum out-of-pocket limit, because the price of care is only part of the story. The amount you actually pay depends on how your insurance plan works. 5 questions, a few phone calls, 10 minutes of research, and potentially thousands of dollars saved. Not because the surgery changed, but because you understood the system before the bill arrived. The woman in North Carolina who received the $62,000 bill for her appendectomy didn't choose that hospital because she believed it was better. She chose it because it was closer. She chose it because she needed care. And like most patients, she assumed the price would be roughly the same. She didn't know there was such a large difference. She didn't know she could compare prices beforehand. And she didn't know the information was sitting on a website she had never been told to visit. The information existed. The tool existed. The transparency file existed. What was missing was awareness. Now you know it's there. So before your next scheduled surgery, before your next imaging study, before your next non-urgent procedure, take a few minutes and look. Find the CPT code. Compare facilities. Confirm every provider is in network. Understand your deductible, because the difference between the most expensive and least expensive in-network option can be thousands of dollars. And that's information you can use before the bill arrives, not after. If you found this useful, subscribe. Every week on Rounds and Revenue, we break down the financial and business realities of healthcare that most people are never taught, but everyone eventually pays for. And if you know someone with a scheduled procedure coming up next month, send them this video, because the bill may arrive later. But the decision that shapes it is often made long before that. Now they know that too.